Can smoothies prevent hypertension and clogged arteries? This is Dr. Westman with another Dr. Westman Reacts. If you've been wanting to try a keto diet, but you feel completely overwhelmed and confused, I have a free guide that has 9 more great tips on how to start keto right. It's a handout with a link in the description below. I was sent a video from Motivational Doc, the Heart Healing Smoothie. Prevents clogged arteries, lower blood sugar, and cholesterol. Dr. Mandel. Let's take a look.
I want to share with you my favorite dessert smoothie. Really not even a dessert. Great for your cardiovascular system, digestive system, for your glucose, insulin levels, and so much more. Let me share my special ingredients so you can stay healthy. This is my chia seed.
My first reaction is there are a lot of ingredients there on the counter. Do I have to use them all? I guess. Not being someone who's been in the smoothie world, I'm more inclined to use something I don't need to add a lot of things. And then I'm not a big proponent of adding in vitamins and supplements. I think you can get all the nutrition you need from the food you eat if it's excellent food. So, but let's maybe there's some extra benefit here, perhaps, and if you're in the habit of having smoothies, it's no big deal for you. Let's keep going.
Chia seed, omega-3s, lots of fiber. It's going to actually flush out through your digestive system, going to make you more regular, as well as my flax seeds, more omega-3s, more fiber, lots of minerals, nutrients, phytonutrients, and my cacao. Heavy in magnesium, it's going to relax you, increase blood flow, it's going to help you sleep good. This has powerful antioxidants and anti-inflammatory properties. And now we got our strawberries. We have low glycemic index, lots of fiber. Everyone can eat strawberries. If you're a diabetic, if you're on whatever the keto diet, it doesn't matter what diet you're on because strawberries are #1 with great flavor. And
well, they may have great flavor, but I guess, so keto is not a type of food. It's not a product you buy that says great, keto product. No, keto is a metabolic state. It means you're a fat burner. You're using body fat, and ketones are a metabolic fuel. So you have ketones around, they're around in the blood, sometimes in the urine and the breath. And it's a metabolic fuel. That's why it's called ketosis, and that's why it gets a bad name, because most people don't have ketones around because they're eating lots of strawberries and things like that. So I see it seems to me the direction he's going is you have to add in things to get healthy. Well, I'm not so sure. I think you can get healthy by reducing or eliminating unhealthy things. And I guess I'm agreeing in that there's no forbidden food on a keto diet, but if he's going to use all of those strawberries in that one serving, that will probably raise your blood glucose and raise your insulin, which is what we're trying to prevent for health reasons. So let's keep going.
And my bananas, a little bit of sweetness to our smoothie, very healthy, filled with potassium, lowers blood pressure, great for your electrolytes and cramps. And what else do we have here? Ooh, my almonds for your cardiovascular system, filled with monounsaturated fatty acids. I love almonds. Makes you alkaline, great for your digestion, going to give you lots of satiety, you're going to keep you from overeating, and it's great to help you lose weight. All of this is. And
well, almonds, nuts in general, is a mixed bag that some people can't stop eating nuts. And so on my simple version, which I got from doctors I learned from doctors who were using this from the 1970s to 2000. And then we did our research at Duke since then, and using it in a clinic at Duke University since then. At first, I don't let people have nuts if you're starting out, especially if you can't control eating the nuts. So a good point here is when I look at Dr. Mandel, he's slim, appears to be, he looks like he's in good health. That's a different way of eating for me. That if you're trying to reverse diabetes, you have several hundreds of pounds to lose, you have any condition related to insulin resistance, like fatty liver, polycystic ovary syndrome. These are things that will be very difficult to eat these things in that context. So if you're trying to reverse metabolic diseases, I'm thinking this is not going down the right path. But if you're at a steady state, you're otherwise healthy, then I think this may be probably fine. We'll see what else is put in the smoothie.
And again, your kind of milk, whatever you like, your choice. I use about 3/4 to 1 cup.
Well, milk is interesting. So skim milk that we were taught, well, I was raised, was the best, is actually the worst in terms of looking at the number of grams of carbohydrates. And I use total grams, not net. And so heavy cream and half look better as a liquid dairy product than skim milk or 2% or even whole milk. So if he's going to use that big thing of milk and these berries, and there's a 1/4 cup of berries is going to be 5 grams. He's got 2 half cups almost, so that's 10, that's 20, that's 30. This is now adding up to 30 to 40 total grams for the smoothie. But wait, maybe he doesn't drink it all in one setting. Let's see.
To 1 cup of almond milk I like, depending upon how thick you like it. But again, remember that our strawberries and our bananas are frozen, so you use less ice. Depending upon how it comes out, if you want it nice and thick, you add more ice, and that would be great to do. So let me blend this up right now and show you how beautiful that this healthy elixir smoothie is for your body, because I think you're gonna love it. First thing we do, we put our frozen bananas and our frozen strawberries in there. And now we're going to do 1 tablespoon of chia seeds, 1 heaping tablespoon of flax seeds, and a tablespoon of my cacao powder. We'll pour our milk in there, and we'll throw 1 handful of almonds, just like that. So here is my favorite smoothie, elixir, or dessert, whatever you want to call it. This is what I have for my breakfast. I'll even have it sometimes as dessert after my dinner. This is going to do wonderful things for your body, your cardiovascular system, your blood, your liver, your digestive system, and most important, you are going to love it. And your body is going to love it too. So please share this video with your friends and family. Leave your comments below, because I expect many.
Oh, that's good. Makes me want one the way he talks about it. But so I guess that's a serving, the whole glass there. And since I didn't hear unsweetened almond milk. I'm familiar. A lot of my patients will drink unsweetened almond milk, so I know that product. It has less than 1 gram per serving. But I'm assuming this has 30 to 40 total carbs for that, and that's kind of high if you're trying to stay in ketosis or use a metabolic diet. Well, and this is just one meal or one smoothie. So whenever someone talks about a certain food, a certain way of doing something like a smoothie, you want to ask yourself what else is being consumed in the rest of that day. Don't take it out of context, but in the context of what else is eaten. So I think there's a bit of extrapolation using the omega-3 idea for heart health, and you can adjust your omega-3s, omega-6s, and have more saturated fats, which are healthy for you actually, without adding in those things, the flaxseed and chia seeds, although if you like them, great. I didn't see any evidence presented for this other than it tastes good, and although that's an important factor, I know. So the ingredients here being the chia seed, flaxseed, the fruits, and the milk. These are going to be a little high if you're trying to stay in a ketogenic state, especially if you're not exercising. And most of the people who come to me cannot exercise because of knee pain or other sort of physical limitation, but that's okay. Keto diet, fat-burning diet can work without exercise, without regard to movement actually, because you're turning your body into a fat-burning machine. So, I would say that this is in the right context if you're able to use these kinds of carbs and burn them up through the day. I would say this is fine if you're at a metabolic goal, you don't have a serious metabolic problem to reverse, but I would say not so good if it's in the context of you trying to lose weight, trying to reverse insulin resistance or type 2 diabetes. It's a little too many carbs. So it depends on the context here. Approved on the one hand, and then not evidence for this kind of approach in a keto diet. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out AdaptYourLifeAcademy.com.